And so this master's program would have been my first online program. So, you know, poor girl don't even understand how to use a computer that much, going to do full-time online classes for a graduate program. So the program was going to be a 2.5-year program. It was, you know, they do the courses quarterly, and the payment plan, you can do either you can take your student loan, or you can do a payment plan where, you know, you pay per month, or you can just pay upfront. So whichever of them you decide, you know, whichever one is feasible for you, then you'll go with that. So I went ahead and started the program. Everything was going fine. As I said, the challenge for me was more of the online. I wasn't able to, you know, get in contact with certain persons as I would love to, you know, seeing my fellow classmates, interacting with them, especially when it comes on to quiz time or test time. I like to study in groups and, you know, be discussing with other persons. So that was missing from the whole thing. There was a lot of coursework that was done in group as well. So you had to be exchanging number and communicating either via telephone, text, calls, emails, whatever it is. And then I just had a problem with, you know, persons being not reliable, because, you know, you can have persons being assigned a task just because of my experience in college, and they don't follow through on their assignments. So I never wanted it to be a case where you give somebody the task to do, and you're relying on them to do their part so you can actually get your good grade, and only to find out that they're not doing anything. So you basically get a lower grade than that you would expect to have gotten for the course, or, you know, for that section of the exam or paperwork that you're in a group for. But for the most part, everything went well for the first year. And then when it was time to try and get my clinicals going for my practicum courses, it turned out that at that time, you know, COVID had started, and so it was difficult because no, all my clinical sites. So the thing about the program is that you have to find your own preceptors. You have to find your own clinical sites. You have some universities who provide, you know, the practicum sites. Some do have like agreements with other locations, and so they will be more willing to take you as a student. There are others who are a little bit hesitant to take you as a student because of past experience that they've had. So it depends, but for the most part, my school, they had like affiliations with other places, but it turned out that, you know, a lot of persons weren't renewing their affiliation with the university, and so that was just something else, because now I am like driving 4 or 5 hours to try and find a clinical site just to speak with somebody to say, hey, I'm begging you, I'm asking you. They always say young girls don't beg, but I tell you, you have to literally be going to these places to be asking them, begging them for the opportunity to do your clinicals there. Otherwise, that was the hardest part about the graduate program, you know, finding your own clinical sites. When you do finally find a clinical site, or at least for me, when I finally found a clinical site, then as I say, COVID hit. And when COVID hit, like a lot of places weren't, they weren't at a point where they were ready to take on students, because nobody knew much about the COVID virus, and so they were a little bit hesitant with, you know, the amount of persons that were going to be in their clinics. So the use of, like, you know, PPEs was a concern, you know, probably cross-contamination, or just a lot of things related to, you know, the disease itself or the virus itself spreading, they were concerned about. And so they canceled all the contracts or the agreements that they had with students, including myself. And so I was there and I'm like, this doesn't make any sense, because you're doing, so for example, the course is a 5-credit course. 3 hours was gonna be allotted for your clinicals, and then 2 hours was gonna be for your classroom or didactics. And so it was canceled. So now you're looking at, you know, your 5 credits being canceled because you can't do your clinicals anymore because there's nowhere to do it. And so I reached out to the university and be like, hey, is there any plans in place to, you know, assist students who want to do their clinicals, who have gotten canceled but can't get a chance to do it anymore because the clinical sites are not willing? And they were like, oh, we're working on something, because a lot of students were having that issue. At that time, they decided to go ahead and say, okay, then we're gonna split this thing in 2. So if you can do all of your classroom portion or your didactics, no, you'll have 1 year from the date of completion of that classroom portion of the course to do your clinicals. And so I like the idea of that because, as I said, it was a bit of a challenge, and I never wanted to be like just hanging there not doing anything during that time period. And so what I did was I made use of it. So I went ahead and started doing the classroom portion or the didactics in order to prepare me for whenever the clinical started. So when you're doing the clinical courses, you can only do you can't be working full-time, you can be working part-time, but it has to be like a certain amount of hours, and you have to do sign like some waiver or some forms to say this is the situation with your work, because they don't want it to be a case where you're doing 2 clinical courses, which is going to be 10 credits, and then you're going to be probably feeling stressed out about the whole thing and probably ending up failing the course. So they want it to be a case where you're doing the bare minimum and still doing your clinicals at the same time, which is understandable, because I tell you, graduate program is very expensive. It is very expensive. So I went ahead and do the didactics. I did the classroom portion of the course, and what I was doing at that time was I was just ensuring that I try to get as much as I possibly can. So I was doing like, say, 2 courses at the same time, because remember the classroom portion was like, say, 2 credits each. So I was doing like 2 courses at the same time in an effort to finish, just in case, you know, somebody decide that, oh, I can go ahead and start taking students. But at that time, nobody was still taking students in their practice. So for 1 whole year, I was literally, you know, trying to do my clinicals, not being able to do it. I was able to complete all my didactics for the courses that I have, which is the practicum courses.